And I don't have a particular preference of whether you guys want to use the stockinette or not. I don't have a preference. If you guys like it, it kind of makes it nice and tidy and clean. But otherwise, you don't have to. I'm just gonna go with that anklet. You okay with that?
Yeah, that's fine.
So biggest thing, so holding, it's nice if you can hold it down, it tends to be a little more stable. If the patient's kind of on the bed and up and you're putting pressure on the heel like that, it can push it, anteriorly or medial-laterally. So sometimes, holding it down is okay. And then if the nurse, can just kind of hold the leg and then grab the toes like this to hold just a little tension, that will help stabilize that talus in an unstable, ankle fracture, right? Because that talus wants to shift out. Typically, it's shifting out laterally. So if they're grabbing her by the toes, they can just kind of internally rotate her toes a little bit. You can see I'm pulling her foot over just a little bit. And that kind of, not a ton, but just enough, because otherwise it'll, just pop out.
Yeah.
So then while they're holding, then of course you would wrap them up. That stuff, the Orthoglass has padding on it,
Yeah.
so you don't need a boatload of this stuff. But I always like to have at least some layer underneath. Number one, for heat protection, because that stuff gets hot, but number two, just a little bit of added padded protection. And of course, the medial and lateral malleolus right here, those are the two areas that are the most prone to having pressure with the splint. So that would be the area where you'd want to put a little extra action there, right? And make sure that you're going to get enough padding around those spots. So as long as you've got those spots, with enough cushion, then you can go with kind of your, your single layer or like overlapped layer up. So up here isn't as important, but certainly here on those malleoli, those are the important spots for sure. And then you guys know how to do this. So again, the benefit of having someone hold by the toes is that they're out of the way. Because when you're putting this on, so another trick that you can do is you can take, even before you put your stockinette on, you can kind of measure with a piece of stockinette, because it's always like, well, God, how long is it, right? Well, you can kind of measure with your stockinette and take that over here and say, okay, we need that much. So tibia tubercles way up here. You don't need to go any higher than that. I would stay, at least a couple finger breadths below that tibia tubercle. That's usually enough, leverage to hold that ankle in place.
So much better than that old OCL plastic wrap.
Oh,
Yeah, that's what I grew up on. Really terrible, a mess. So depending on your confidence level, if you feel good about the reduction, you feel good about everything, then you can use hot water. Hot water will stimulate it to heat up faster and set up faster, which is always kind of nice when you're in the ER and it's busy. If you're not confident, use cold water. That way it'll take a little bit longer. So you're kind of splitting it in the middle. Again, you want to kind of be in the middle of the arch to the bottom of the heel, and then you're kind of going up like that. So again, we talked about the possibility of the posterior slab if you want, but once you get it in this spot here, the key is, again, it's around those malleoli, right? That's where the instability happens. So as you're wrapping, obviously you don't want to wrap too tight, you don't want to wrap too loose. It's kind of a Goldilocks technique. But that's gonna wanna slip down, so make sure it stays up. And then once you get it around that malleoli, you're gonna put a few wraps on there, but then you can take it and you can still then manipulate with that unstable ankle fracture. You can kind of put your hands on the medial and lateral malae and just kind of, mold that splint in there. Not crushing it, but just hold it and make sure that you're kind of looking at her leg and making sure that it's still in decent alignment. Because this is, this process is where it'll want to sublux out. And if your foot's sticking out to the side or a little down or whatever, this is the point where you kind of manipulate it and then you just hold it like that. So that's that. So again, it's not the prettiest, but just take another ace bandage and wrap around the side.